with you previously, arriving travelers will undergo a travel risk assessment upon entry into Bermuda and could have their health monitored and their movement on island restricted for up to 14 days. Those who have spent time in jurisdictions considered at very high risk will be given health instructions for follow-up and monitoring for 14 days. There are government officers at all ports of entry to assist with managing the situation, and port officials are in continuous communication with the Ministry of Health's Epidemiology and Surveillance Unit. Following on from those efforts, we are currently looking at ways to enhance the reliability of customs information from travelers entering Bermuda. We want to ensure that all customs officers will ask the same appropriate questions on all arriving passengers. Consequently, we are also in the process of finalizing travel forms for arriving passengers, requesting specific travel details such as where they have traveled and when. An incomplete disclosure of travel history could lead to a potential health risk for our community, and therefore we want to appeal to every traveler to please be truthful when you fill in these forms and when a custom asks you about your whereabouts and your travel history. Additionally, we are already in the process of creating publicly displayed information for healthcare facilities, which can be used to protect those facilities from illnesses, such as posters encouraging people to call ahead prior to entering that facility if they feel unwell with respiratory symptoms. Yesterday, I announced that the government is actively resourcing extra supplies of hand sanitizer for the island. And once on island, they will be available at government offices and will be distributed throughout our community, starting with at-risk segments of our community, such as the population of seniors. Additionally, government will also waive customs duty on hand sanitizer and other supplies as deemed necessary in the fight against influenza and COVID-19. Washing hands and using antibacterial wipes and hand sanitizers may seem like an overly simple thing to do to combat serious respiratory illnesses, but in fact, it is two of the most effective methods. On the topic of procuring supplies, there have been many questions asked about the supply of N95 masks on the island. It is accepted that these masks are in a global short supply. However, I want to assure the public that we are working to acquire these masks as quickly as possible and have placed a request for more from Public Health England, which has been assisting us throughout this exercise. Additionally, it should be noted that the use of face masks during outbreaks of viral illnesses such as COVID-19 has only been shown in scientific studies to be effective for protecting healthcare workers and to reduce the risk of sick patients spreading the disease. Based on the evidence, the World Health Organization recommends the use of health masks by the following: people who have a respiratory symptoms such as coughing, sneezing, or difficulty breathing, people who are providing care to individuals with respiratory symptoms, and healthcare workers when entering a room with patients or treating an individual with a respiratory symptom. It should be stressed that wearing a face mask alone is not guaranteed to stop infections in any of those circumstances and should be combined with other personal protective measures such as hand hygiene and keeping your distance from people with symptoms. Another question we have been hearing a lot of relates to the availability of test kits on island for COVID-19. These test kits are not commercially available anywhere in the Americas, except in research settings. For Bermuda, testing is currently available only through the World Health Organization's collaborative centers, as well as in the Coffer Laboratory. 4 to 5 days is the standard turnaround time to get a result, and so far Bermuda has completed 3 tests, all of which resulting in negatives. We are exploring additional testing options through Public Health England and the World Health Organization, and can give full assurance that the government will obtain the necessary equipment as soon as it is available so that tests can be conducted locally. However, it is vital for the public to understand that medically reliable test kits are not commercially available anywhere yet. Investments in research kits that miss real cases and give false positives would not do us any good. I can also inform you that government has assembled a team focused on several matters, including ensuring signage at all ports of entry, that it is robust and clear signage, planning for cruise ship season against the threat of COVID-19, confirming an appropriate quarantine facility, added assistance at ports of entry, specifically at cruise ship terminals, ensuring there are plans in place to deal with mass gatherings such as large sporting events should an outbreak occur, and the national procurement of personal protective equipment for healthcare personnel. To that end, staff have been seconded to the Ministry of Health from elsewhere in government to provide the additional manpower needed to meet these objectives. I now want to talk about the hospital's readiness to deal with the potential seriously ill and critically ill COVID-19 patients in Bermuda. I want to reassure the public that the Bermuda Hospital Board has escalation plans in place which identify options for emergency, intensive care unit, and acute care wards to cope with an influx of patients in the event of a pandemic. The number of beds available at any one time can change based on the day. However, there are actions that can be taken to increase capacity, such as postponing elective surgeries, discharging stable patients, and using additional beds in other areas. There are negative pressure rooms in emergency and on each floor of the acute care wing. There also is an entire floor with 30 beds with an independent air filtration system, which can potentially be used for cases should the need arise. Bermuda Hospital Board's negative pressure rooms stop the air flowing out of patients' rooms, keeping the rest of the hospital safe. And it will be critical for people who can be cared for at home to stay there so that hospital services can focus on those in the most need. Most importantly, no one should turn up at the hospital or other healthcare provider without calling ahead first to inform the healthcare personnel of their symptoms and receive advice and next steps. The hospital has more seniors and people with existing medical conditions such as diabetes, heart disease, and hypertension in waiting rooms and our long-term care facility. While there are many unknowns about COVID-19, experience to date indicates that approximately 80% of people only have mild to no symptoms and will not need any hospital care at all. Of the rest, a portion will be able to receive medical care at home, and a small percentage may need critical care services with intensive medical management. Therefore, we do not anticipate a situation where COVID-19 that would require the entire patient population to be relocated. I want to just add that the government is prepared to provide any additional necessary funding required to prevent, treat, and contain a COVID-19 outbreak should one occur, including any additional hospital expenses to handle an extraordinary situation. I want to urge the public to rely on official sources of information to prevent damaging rumors from creating false narratives and diverting public health resources away from situations posing actual threats. Travel advice is updated daily on the government website at www.gov.bm/health information. Travel advice is currently as follows. Travelers from affected areas are being monitored. Affected areas include China, Iran, Northern Italy, South Korea, Hong Kong, Japan, Macau, Malaysia, Singapore, Taiwan, Thailand, and Vietnam. Travelers who have been in affected areas should be prepared to self-quarantine until a risk assessment is completed by a public health officer. A public health officer will then assess what public health measures should be implemented based on the traveler's risk level. Public health measures may include active monitoring or supervision of self-monitoring by public health authorities, or the application of movement restrictions, including isolation and quarantine when needed to prevent the possible spread of COVID-19 in Bermuda. Any traveler that has been to an affected area and develops fever, cough, or shortness of breath should inform their healthcare provider of their travel history prior to attending for medical care. And you can stay up to date by visiting trustworthy scientific websites such as the CDC or the World Health Organization. And for local updates, visit our health information page at the www.gov.bm/health information, and follow the government of Bermuda on Facebook and Twitter. I'm encouraging everyone to stay well as stay informed. Thank you.
Thank you, Minister. Any questions for news? Just use this.
Thank you. The current list that the government's using is based off the UK list, as I understand. Shouldn't we be developing our own list, because the UK list seems out of touch? So, as an example, Vietnam is on that list. It's had 16 cases. They have no active cases, no deaths. Macau is on that list. It has only 1 active case and 10 in total. Whereas if we look at Germany, France, and Spain, seem like they're more of a danger. With Germany has 203 cases in total at the moment, 187 active cases. France has 212 cases, 4 deaths, 196 active cases. And Spain has 165 total cases, 162 active cases. Why aren't we monitoring those countries rather than countries that seem like they're low risk at this point?
Well, Bermuda's doing 2 things. We are following what Public Health England's travel advisors have been with respect to the locations, but we're also, in addition to that, monitoring flight patterns with respect to the air traffic that comes into Bermuda. As I've mentioned previously, this is an ever-changing phenomenon that we're encountering at this time. So with the assistance of the travel advisors from Public Health England, as well as monitoring of our flight patterns, those circumstances are looked at and reviewed on a daily basis.
But looking at the data on that, doesn't it suggest that those 3 countries that I named, Germany, France, and Spain, are more of a danger than Vietnam with 0 cases going on?
Well, I appreciate what you're saying, Mr. Burgess, and I can yield to Dr. Peatfall, but again, the information that we're relying on is through Public Health England, as well as looking at our own travel and flight patterns.
Sure, I can try to add additional perspective to that, because those are very valid questions. And in fact, every day, that is the discussion in the epidemiology and surveillance unit. The advice of Public Health England is based on their epidemiologic research, how the disease is playing out in their region, what the likelihood of an individual coming from a certain country is of having been exposed or having the infection. That information is very valuable to Bermuda, but you rightly point out that we are a different jurisdiction and in destination. There are things about Bermuda that make us more unable perhaps to respond than a larger jurisdiction. Our capacity to deal with a case is different from the UK. And so we do have to use our own standards as to what countries should be on the list and what countries should not be on the list. If you compare them closely, our standards are not identical to Public Health England. We use them as a starting point. And you rightly point out that some of the European countries are certainly higher risk than those in Asia, as well as the fact that the United States even has cases. So if we were to really go according to the science, there might be some very impactful decisions around travel restrictions that would impact tourism and trade in a way that is not warranted at this point. So there is it's a decision that takes into consideration not just the travel patterns, but also the science, the epidemiology around who is being affected in a certain scenario, as well as weighing the impact on our community if we were to make a decision that really negatively impacts trade and travel. So it is not a very cut and dry decision. It takes a lot of discussion and consultation, not just within the epidemiology and surveillance unit, but with our other partners. So it is one that's made every day. We are not just using Public Health England as the guide. I hope I'm clarifying that, but we do have to tailor their advice to our needs locally.
It sounded like a little bit like trade considerations or
trade.
Yeah, because you talked about our trade partners. Well,
that's always a consideration. The well-being of the island depends on not just the health aspects, but also the economy and many other social factors. And so they really do have to be weighed. Yeah.
As a different question, on the BA flight at Gatwick, they've got a board up. It lists 10 of the 12 countries that we have on our list, and not all 12. but it also says entry permitted, immediate quarantine for a minimum of 14 days on arrival.
What does that mean?
Well,
What's your question?
well, the BA flight, when people are arriving, it says that people who are from these countries will be quarantined for a minimum of 14 days.
Will be quarantined? Where
Yes.
where are you reading from?
Somebody took it off the board at Gatwick. There's a
Okay,
photo
so
here.
what is your question?
So is the board incorrect in stating that people from these countries are going to be quarantined for 14 days when they arrive?
I can only speak to what Bermuda's current travel advisory is, which is that if you've come from certain countries, you should be prepared to have a public health discussion with the public health resource that's at the airport or on the phone, and a decision is made on an individualized basis. So the worst case scenario in terms of your freedom of movement is that you might be asked to self-quarantine for 14 days. But there are so many scenarios. Perhaps you're on day 13 of your last exposure. The quarantine might be just one day. Perhaps you actually are not coming from a country that put you at high risk of exposure. You may be allowed to simply self-monitor. So our current advice is fairly generic for that reason, because it cannot speak to every single scenario. So the advice is to let individuals who are traveling know that they should be prepared, that given the specifics of their situation, they may be asked to self-quarantine, they may be asked to self-monitor, they will be followed by public health for approximately 14 days from the time of last exposure. I'm not sure that that answers your BA question. I'm not prepared to talk about what is in the airport there in the UK, but I hope that explains our current advisory.
Okay. I guess then somebody needs to, this may not be for you, but somebody needs to contact BA about putting the correct information up on the flight board.
Yes.
One last question. After people have been assessed, it talks about, because you were following the CDC measures for self-isolation, is that correct? Yes.
That is correct.
Okay. Right. So on the CDC website, they talk about after they've been assessed, it talks about active monitoring or supervision or self-monitoring by the public health officials, and then they could have either their movements restricted, or they could be isolated. So of the cases that we've had to go for isolation or
For testing,
self-monitoring,
you mean?
yeah, self-monitoring after they come, how many have fallen into the category of having their movements restricted, and how many have fallen into the category of being isolated?
I did bring some information with those numbers with me, but as I pull it out, what I would like to say is that the advice from the CDC is very useful to us, because that health system, the U.S. health system, is very familiar to us. Patients come from Bermuda to the U.S. health system. We find the advice quite relevant to this setting, and so we have followed it. It's hard for me to talk and look for it at the same time, so let me just answer your question. The advice from the CDC allows for a risk assessment to occur. That is, those in a high risk category of exposure, those in a lower risk category of exposure. And so, as I was describing previously, if you're in a lower risk category of exposure, the requirement is that you would simply self-monitor. You can go about your life. You have to pay attention to your well-being, how you're feeling, whether you're developing symptoms of cough or of fever. And so you're independent. On the other hand, if you're in a high risk situation of exposure, possible exposure, there will be a request that you self-quarantine. And that is because some of the symptoms are not very prominent, and individuals can possibly be infected and not be aware of it. And the natural history of the disease, the level of infectivity, is not clearly known. There may be some asymptomatic spread. So if you're in a high risk exposure, if you have a high risk exposure history, you really should be self-quarantined. And so the advice, while it's generic, it does go some ways in risk stratifying so that everyone doesn't have the same level of social disruption. It's based on their risk. And you were asking how many people have we monitored, and I thought I actually had brought that bit of information, but it would appear that I did not. So we can get that for you. Our epidemiology is keeping track of it, but I seem not to have picked it up. I can say roughly 95 individuals have been monitored through the airport. Approximately 29, as I recall, required active monitoring. And at this time, the number is something like 4 or 5 people are still under active monitoring. That process expires after 14 days. So people are constantly getting on the list of monitoring and constantly falling off. But I do know that the number is 95 have been managed so far in that fashion.
Good morning.
Oh.
I'm not sure who these are best for, so whoever wants
I'm
to
happy
jump in would be
Give
great.
someone else a chance.
So just to confirm, there are no current travel restrictions in place in Bermuda, is that right?
Yes, that's correct. No travel restrictions.
No
It's a matter of logistics. We have just the travel advisory that was mentioned before.
Okay, are any travel restrictions planned or forthcoming?
That's being considered, but
that's-
I was going to pass it on to someone else to
Do you want
give you the details.
Okay.
So we've had a look at international, what's happening on the international scene in other countries. And how it works is we have the Public Health Emergency Response Team, which is chaired by the Chief Medical Officer. And I was assigned to do some research, and I've made the recommendations on what we should do following international and regional guidelines. The Public Health Emergency Response Team will then raise those recommendations to the Minister, which will go to Cabinet, and the Cabinet will make that final decision. So that's where we are today, which is hot off the press, and we expect to see some news coming on what Cabinet says yes or no to.
Okay, apologies. Your name is, sir?
So I'm Steve Cosham, I'm the National Disaster Coordinator.
Can you tell me about what those recommendations are then that you've submitted?
Well, it's going to be recommendations on travellers from countries or flights from countries. What they are specifically, that's gone to Cabinet, so it's Cabinet's purview to look at those first.
Okay. Wanted to talk about, if I could, quarantine and self-quarantine. Are there any considerations in place? So everything that's being done as far as quarantining at this point is self-quarantine, correct?
Correct.
Is there any thought that that is going to have to be accelerated or advanced to required quarantining at any point?
Yes, the practical considerations weigh heavily in this. That is to say, for residents of Bermuda who need to be quarantined, there is no need to create a new environment for them to be quarantined. Home quarantine has been shown to be quite adequate worldwide and quite practical, as opposed to putting people in special facilities. But there are conceivable situations where a designated quarantine facility is required, and that's what we're working the logistics of now. Such an example would be a flight that arrives in Bermuda unexpectedly, and an individual is ill with symptoms of COVID-19, and then individuals on that flight would be exposed, perhaps, in that setting, and would need to be quarantined. But the details would need to be worked out, and currently that is what is underway.
Sorry, the details would need to be worked out of a
Quarantine facility
So there
that
is
is
no-
appropriate. There are considerations for several facilities on the island. I think approximately 10. So
Can
there
you
are possible locations, but
provide what locations are these being considered?
those are matters that are under discussion right now. So I'm not able to give the details of that.
Is
That's
there-
part of the information that is being presented to the minister.
You said that
Cabinet.
they're under consideration. Is there a reason they haven't been nailed down as to where this facility would be?
I couldn't answer that question for you.
Okay, so every small island jurisdiction is going to face the same problems. We don't have unoccupied facilities that are turnkey, ready to go, that can be used for isolation facilities. If we look at private facilities, people would say, let's use a hotel. There isn't any hotel or small guest room on this island that would turn around and say, sure, bring in people with suspected COVID-19 and we'll look after them, because the stigma that would have. So it really needs to be public facilities that the government owns or Aquango owns. So we've sat down with Works and Engineering. We've had a look at all the 1,500 properties, I think it is, that government manage, and we've identified the top 10. So where we are now, the recommendation is a small team of people consisting of health, Works and Engineering, security and disaster management, look at those 10 facilities, and we assess what work has to be done. There is not a turnkey facility ready on the island. They are in varying states of repair. We've looked at ones which are almost ready to go, but they will take budget and they will take time to get up and running. So we are actively looking at those 10, and they're going to be different classifications. There could be a facility for a single traveler. It could be for a family. And the biggest facility we have would be up to about 20 rooms. And that's where we are right now. So I would imagine in the next few days, as this matures, we'll have more information on this.
Can I just add something actually to that? And thank you, Steve. One of the comments that Steve just referred to was with respect to the budget. And I've been given assurances not only from the Premier, but also from the Minister of Finance that though as the Minister of Finance would indicate we don't have a blank check, money is not an option. The Premier has assured us at the Ministry of Health that whatever resources are required to ensure that we address this measures properly and adequately according to international recommendations and so forth with respect to COVID-19, including the establishment of quarantine facilities, the securing of hand sanitizers and the like, that is not an option. So there will not be, that is not an obstacle.
Sure. Maybe my last question then. How many ICU beds are there at King Edward Memorial Hospital?
Thank you. Currently, we have in the intensive care unit, the adult intensive care, we have 9 intensive care beds.
9?
9.
Okay. Sorry, your name is, sir?
Dr. Richmond.
Dr.
Richmond.
Thank you. Appreciate that.
Hi, good morning. This question is probably for Dr. Richmond as well. How many mechanical ventilators are currently available at the hospital for those patients in critical care?
Obviously, the 9 intensive care beds have ventilator capacity. We have additional ventilator capacities which are housed in the operating theatres. We have ventilator capacity in the emergency department, and we have, I believe, 4 additional ventilators which are maintained and functioning, but not in current use.
Are there any plans to place orders for more ventilators, or is it on a needs basis?
Well, in terms of, it's not just a matter of the ventilator capacity, it's the staff that are able to manage those ventilators on a round-the-clock basis. So currently, we have more capacity than has been required. But in terms of how do we escalate that going forward, it's not just about kit, it's around personnel as well.
How many staff members are capable of operating those machines?
I'm unable to answer that in terms of specific numbers, but I could return with the appropriate answer in the very near future.
Just one last question. Can the hospital isolate COVID-19 patients from the rest of the hospital, or is there a plan in place?
The hospital is exceptionally well provided for. It has a number of what we call negative, the minister referred to this in her presentation, has a number of what we call negative pressure rooms in the acute care wing, as well as in our intensive care unit. So we have 11 negative pressure rooms, which for any jurisdiction is a significant number, but for a small jurisdiction such as Bermuda, we are well served in that regard.
And what's the availability of protective equipment, masks, gloves for staff?
Well, currently we have a ready supply of protective equipment, of what we call PAPR masks, which are reusable protective devices. for the staff to use. We have a supply of disposable gloves, gowns, and masks, and we are always looking to make sure that we have got a good supply chain for those to be replenished.
And would the Lamfogo unit be a place to be considered should the need arise?
Absolutely. In terms of the hospital provision of care, obviously, as already been alluded to, the vast majority of COVID-19 cases do not require hospitalization, but we stand ready to escalate appropriately, and the urgent care center at Lamfogo is part of our footprint and would be used appropriately.
Okay. Any further questions for the
Hi, I was just driving. I heard your talk on the medical ventilators. I counted there's probably a handful, maybe 20, and the R naught on this is quite high. We're hearing that the critical cases are about 7%, 5-7%. If you had 50% of your population infected, what would that mean in terms of the caseload for those needing critical care and ventilators? You'd be talking in the hundreds, right?
That's a very valid question, and of course, there is not an unlimited supply of services. So if 60,000 patients had COVID, you're quite right. 5% of that is 300. The hospital doesn't have 300 acute beds, never mind ventilators, and it certainly doesn't have the staff to service that. So it is a balanced response, and like anywhere, we are dovetailing that balanced response as we see the situation evolving. A worst case scenario, if 60,000 people on the island all had COVID-19, we wouldn't have any staff anyway.
So then for the minister, what is the red line?
Just a minute,
Well,
Dr. Pico.
Go ahead. I think I was just asked to put some reality into the discussion with regard to what is likely to happen with COVID-19 if it arrives. And that is, as Dr. Richmond said, the vast majority of individuals either have so few symptoms they don't notice or have no symptoms at all, or are mildly ill and don't end up in hospital. So we've seen that play out in every other jurisdiction up until now. That is, the population itself doesn't end up needing hospital care. 80% or so of everyone is in the community and is managed in their homes carefully to control the spread. So I don't think we could panic ourselves thinking about this almost unimaginable outcome. I think it's better to plan for the most likely scenario, the likely scenario, and we are planning for that, as well as the worst case scenario. But I think the situation of monumental proportions, biblical proportions, is one that we are making the decision to spend less of our time on than the more likely scenarios of large numbers of people simply being unwell in their homes.
Right. You just quoted 80% with mild. That means 20% have some form of more serious.
Yes, and 5% of them can be seriously ill. You were correct in saying that.
So you take, I don't know, 30, 40, 50, 60% of your population. That's still quite serious numbers.
That's quite a lot of people, yes.
So then the question for the minister is, at what point do you draw the red line? You're an isolated country. You can isolate yourselves. At what point do you say, we're going to protect the country? Yes, there will be economic impact, but rather than having a large percentage of people sick and potentially passing and dying, when do you make that decision?
Well, I know you just arrived, and that was a question that was asked a few moments ago, about a half an hour ago, actually. At this point, the Public Health Emergency Response Team is meeting very regularly, and they are providing information, obviously, to myself, who, of course, passes that on to the cabinet. The decisions with respect to whether or not Bermuda decides to enter into any type of travel restrictions over and above the travel advisories that are currently in place are decisions that will be made at the cabinet table. And again, because the public health team is meeting on a regular basis, information that they get is based on international standards, based on information that they're receiving from the World Health Organization, as well as CAFA and the Public Health of England. So those are all information that has to be reviewed and disseminated. And as Dr. People said earlier, there is scientific studies from epidemiologists that show and speak about the patterns of this, et cetera. And all of that information will be taken into consideration. So to answer your question, when will we reach a red line? We haven't reached a red line, but those are all the considerations and the expertise of all these people behind me and behind in other ministries and departments that aren't actually physically here is being brought to bear as to decisions that will be made.
Thank you, Minister.
Thank you.
One last question.
Based on your models, what's the most likely scenario for Bermuda?
Models of what? I'm sorry.
Sorry, of disease patterns in other countries.
Sure.
I can try to paint a picture. Our expectation is that at some point with the travel that occurs in Bermuda and around, and we're part of the global community, COVID-19 would arrive. And as in 2011, when H1N1 arrived on our shores, there are individuals who are unwell and need the care of their family physicians. There are individuals who get sicker than that and need hospital care. And on rare occasions, individuals die. There is the possibility of death. And I think it's for that reason that we stress that it's important for us as a general population to right now aim to be as healthy as we possibly can. If you have a chronic medical condition or are over the age of 60, which a lot of us are, you are at higher risk of getting sicker when a respiratory illness is introduced into the community. So you should take extremely good care of yourself now before that happens. All individuals should make an effort to protect their immune system by getting adequate rest, good nutrition, taking their medications if they have a chronic illness so that they don't end up needing hospital care in a situation where there is an infection on the island and the hospital needs to be protected from preventable causes of hospitalization. So there is quite a lot that we all should be doing right now. The hand washing, the learning how not to touch our faces, which is something very difficult to learn. We need to be practicing those healthy habits right now so that when and if COVID-19 arrives at our shores, we are less likely to be infected. And certainly if we've taken care of ourselves, we're less likely to get critically ill. But the world has seen this before many times and will continue to see it. And I think it is important to recognize that there's a lot to be done before a novel virus arrives to maintain one's general health and to make habits that are going to be useful in that setting. I would like to stress that that's what we should put our energy and our focus our time on, because that's what we have some power over, rather than spooking ourselves needlessly or panicking ourselves. Prevention is very powerful, and I think it's important that people focus on that at the moment.
Okay. Thank you, Minister. Thank you, speakers. Thank you, media.